So when we look at the records, what are some common things that we see that disqualify them? Now, I will say that a lot of this is very much agency dependent. So GS Healthcare does their due diligence before they send us records, and they've already weeded out many of the poor candidate surrogates. Some other agencies aren't as thorough, which is fine. So when we look at those records, some things that we see off the bat that we say no are surrogates who have a history of very premature deliveries. Now, if it's one very premature delivery followed by some full-term deliveries, okay. But if she's had one very premature delivery and no deliveries thereafter, or a history of premature deliveries, that is not a great surrogate candidate. Or perhaps in the past pregnancy, she had high blood pressure issues, which is fine, but especially if it's a very severe form of high blood pressure where she needed a lot of medication to manage the blood pressure to the point that even after she had the baby, she still had blood pressure problems. That is very concerning because high blood pressure in pregnancy tends to be recurrent. And if it is not well controlled, the surrogate is at risk for something called eclampsia, which is where she will have a seizure. And if she's having a seizure and the baby's not delivered, the baby gets no oxygen. So a significant history of high blood pressure in pregnancy is another disqualifier. Severe diabetes in pregnancy. Diabetes in pregnancy result in babies that are actually quite big. And many people think, oh, well, that's great. It is, except for the fact that their lungs don't mature accordingly. So a lot of these babies are big with very immature lungs and end up having to go into the ICU. So again, a lot of it really depends on the severity of the diabetes. Another disqualifier is what happened during the delivery. Many times we see records and the surrogate almost lost her life in the delivery of the pregnancy. She needed blood transfusions because she was bleeding tremendously. They gave her medications and they couldn't get her to stop bleeding. This is indeed a case-by-case basis, but it makes me very worried that this may happen again with the next pregnancy, right? Because remember, a lot of you surrogates, you have kids at home as well, right? So keeping you healthy and safe so that after this delivery, you can go home and be a mom to your kids is of utmost importance. Another disqualifier is cesarean section reports, where it states that there was an issue with the uterus. And the most common I see is that a comment is made that the scar where the C-section was made. So over time, a C-section scar, because once you cut the muscle of the uterus, it is never as strong as it was compared to a uterus that has never been cut. But after one C-sections, two C-sections, three C-sections, four, etc., when you cut that area, that muscle becomes quite weak. And so sometimes I see reports where it says a very thin window, and that is a disqualifier because the problem is there's a risk that your uterus may rupture while you are pregnant, and the baby will then float out of the uterus into your abdomen. And that is very, very dangerous, not only for you, but for the baby as well. And of course, we look at the overall medical history. So in addition to just medical history, for example, autoimmune conditions, like chronic medical conditions are reasons for pause. It's not a definitive disqualifier, but it really depends on what's the condition, how severe it is. Another common condition is psychiatric history. So it is not uncommon to find women who have a history of depression and anxiety, and many women are medicated for that. And as long as the intended parents are okay with that and they are aware of it, that is a personal decision that you will make. Sometimes I see psychiatric histories that are quite significant. And in cases like that, if it's extremely significant, it is an absolute disqualifier. But if it's something that, okay, it's significant, but something perhaps many years in the past, then I will have a conversation with the intended parents to make sure that everybody is on the same page and understands the risk. So it's medical issues like these where often we will ask for more advanced consultations. So for example, we may ask for a consultation with a psychologist, or we may ask for a consultation with a high-risk obstetrician, also known as maternal fetal medicine, especially when the surrogate has these medical conditions that are very much on the fence, so that everybody can be best educated on what truly are the risks associated with these conditions. And this is why medical records evaluation and the next steps take so long, because we are so meticulous about making sure that we've addressed all the issues and that all involved parties understand what are the risks before we move on to in person medical evaluation at our office.